Hello and welcome to the next episode of the Explain series with your host, Dr. Brett Palmer. In the Explain series we take a sexual health topic and explain it, and this week it's the turn of HIV. Now I did do a previous episode of HIV Why Test, but this episode is just concentrating on HIV itself. So this could be for individuals who you've just found out you are HIV positive and you want to know more about it, or you're concerned that you might have HIV and you're going to go for a test very soon. So you've watched the HIV Why Test video. Or you're just interested and want to know more about HIV. So HIV, what does it stand for? It stands for the human immunodeficiency virus. It's a little virus that is passed on through the blood, and so the most common way it's passed on is through unprotected sex, be it vaginal or anal sex. But it can also be passed on through sharing needles. Blood transfusions is also another one as well. It cannot be passed on through kissing or sharing toilet seats and this type of stuff. I'm commonly asked in clinic, can it be passed on by oral sex? Now, the short answer is no, it can't be passed on by oral sex, but there is a small set of circumstances where actually there have been a few case reports reported that it can be passed on. They are an individual that's newly infected with HIV will tend to have a very high viral load, and if you're giving that individual oral sex and you've got a severe inflammation of the throat, for example gonorrhea, then that could very well cause a very upset bleeding on the inside of the throat, and then it could accept the HIV virus, and then the HIV virus could, in theory, be passed on effectively if you swallow the semen, if you like. And so in those defined set of circumstances that you have gonorrhea of the throat and you're having sex with someone who's recently been infected and has a very high viral load, then technically there is a possibility that you can get it through oral sex. But as a general rule of thumb, no, it's very, very rare. So HIV is a virus. It is believed it has come from monkeys originally, and it hopped over the species from monkeys to human beings sometime in the 1920s, 1930s. And as time has gone on, the virus has spread through the human population to become the epidemic it is at the moment. And HIV is still a problem, with many, many people being infected on a yearly basis. But one thing that has become less of a problem, especially in Western Europe, is people dying of symptomatic HIV. That's HIV that has ruined the immune system. We'll come on to more about that, and has become what used to be called AIDS, which is acquired immunodeficiency syndrome. The reason why that is no longer becomes so much of a problem is because there's medications you can take which halts and brings the HIV down to zero, so it can't cause any damage in your immune system, and then your immune system recovers in time. And when it recovers and you keep on taking the medication, you live your life normally and you carry on doing whatever you want to do in life. And when you come to the end of your life, you die of whatever all people die of. It's much better to have HIV now, for example, than diabetes or chronic obstructive pulmonary disease, usually caused by smoking. And so there's lots of other diseases which have been around for much, much longer, which are far harder to treat than HIV. And so if you do have HIV, this is not the diagnosis it was in the 1980s or 1990s. It's readily treatable, and if you take your treatment on a daily basis, you'll be fine. And that's the important thing to say. So what happens, you've had sex with someone and you've been unlucky enough to catch the HIV virus. Well, what happens? Well, the HIV virus will go into your blood system and will infect a white blood cell. Now there's all sorts of different types of white blood cell, but there's one particular white blood cell called a CD4 cell. And what will happen is the HIV virus will link on to this CD4 cell and infect it. that whole process of getting into the body and going to a white blood cell and infecting it, that takes about 72 hours. And that is why if you've been exposed to someone you believe may have HIV, you can take something called post-exposure prophylaxis, which is a small blue tablet called Truvada. Take that tablet and that can help you stop the process of HIV getting into your body and integrating itself within your DNA. Okay. Obviously, post-exposure prophylaxis is more than one tablet, and it's basically a blue tablet called Truvada and two tablets called raltegravir. You take all three in the UK anyway. You take all three at the same time because you have different doses of raltegravir depending on what part of the world you're in, and you take it for 28 days, and you have to complete 28 days without any breaks. Okay, that's very, very important, and that's post-exposure prophylaxis. There is also a blue tablet, again called Truvada, which people take on its own. That's called pre-exposure prophylaxis, and I'll explain more about these in other videos at a later date. And for the pre-exposure prophylaxis ones, you just take Truvada before you have sex, ideally 48 hours before you have sex. Some people just take it on a daily basis because they don't actually know when they're going to have sex, and that way they protect themselves from getting HIV. Now, if you're in a monogamous relationship and you're having sex with the same person and you've both been tested, then you don't need to take Truvada. Okay, it's important to realise that if your partner is HIV positive and they're taking medication and their viral load is undetectable, you don't need to take Truvada or PrEP or post-exposure prophylaxis. Okay, the important thing is they're undetectable, and as long as they're undetectable for longer than 6 months, undetectable means untransmissible. So there's a little phrase we use called U equals U. Undetectable equals untransmissible. Okay, so where were we? The little virus has got into your white blood cell, and it is come into the white blood cell and become and it has infected that cell. What happens then is the casing around the virus dissolves, and it changes itself from a piece of RNA into a piece of DNA. And then it integrates itself into your DNA, okay? And that's the DNA of the white blood cells, okay? Not the DNA of the sperm or the eggs in your ovaries, only the DNA into your white blood cells. And unfortunately, once you've got it in there, you can't get rid of it. Then the only way to control it is by daily medications. So what then happens is the HIV will then get the machinery of the cell to make more of the virus, and then the white blood cell will shed more and more and more of this virus. Okay, and as you're newly infected, you're shedding more and more of this virus, and the body is then gearing up. Then it takes a couple of days or weeks to get the antibodies your body makes to go against the virus, and that is called seroconverting. Okay, and when you get a seroconversion, some people get an illness with it. There can be a body rash, a fever, which is a temperature. Some people even get rigors. Some people get very ill and feel as if they've been knocked for six and have a very bad flu symptoms. I've seen even people who go to A&E with a seroconversion illness because they're that ill. It doesn't last forever, a seroconversion illness. It lasts for a relatively short period of time and it will go away. But please also remember, a good 40% of people don't have any illness at all. They completely have no symptoms whatsoever, and they can't even pinpoint a possible risk of when they come in contact with the HIV virus. So don't think, oh, well, I haven't had a flu cold, so therefore, by definition, I can't have had HIV. Unfortunately, it doesn't work like that. The only way you can test to see if you've been exposed to HIV or if you have the infection is to get a blood test, okay, and then get a repeat blood test 4 weeks later. So, once your body has gone through the seroconversion illness, and this is the highest your viral load will probably be. Okay, and then the viral load will gradually come down as your body learns to control the virus, but it won't. But it will come down to a level that you can still infect other people, and then your CD4 count while you're being infected can crash down as the viruses infect the CD4 cells, actually kill off the CD4 cells, but you've got other CD4 cells which are fast asleep in the body, and they gradually wake up and recognize and try to fight the virus. Now, this fight between your body's white blood cells and the HIV can go on for a little while, but over time, the HIV will gradually kill off all the white blood cells. And when that happens, then it becomes symptomatic HIV, in other words, AIDS. And that's where you pick up other types of infections. Could be lung infections, for example, bowel infections, eye infections, and also the body starts to break down the ability of fighting other things like cancers. So it's all quite unpleasant, but a lot of that is reversible by taking the medications as soon as you're diagnosed. Okay, there's no point waiting. So if you have HIV, you've been diagnosed with HIV, and you're thinking, should I start treatment? The answer is yes, you should start treatment. Okay, the thing about the virus is it causes floats around in your blood, obviously, and it causes, it's an inflammatory syndrome, if you like. It causes things to be inflamed. In short, it increases your chances of problems with the arteries, heart attacks, strokes, angina, and all the other horrible things that are caused by inflammation of the arteries. This can be calmed down simply by taking antiretroviral medications, because if the virus isn't there, it can't inflame the arteries, and so it won't cause the problems that I've just explained. Okay? And if you're sitting there all smug thinking, yeah, but I'm one of these lucky individuals, the 1% of individuals that can naturally control my virus, I'm an elite controller, and there are 1% of individuals that can control their virus even though they've got HIV, you would still benefit from going on antiretrovirals, and that's what the latest scientific evidence shows. Okay, and the medication is usually very, very good and causes minimal side effects. So that's HIV. The treatment, as I said, is very, very simple. There's 20, 30 different types of combinations of tablets. You can do a 1-pill tablet daily. There's pills you can take with food, pills that if you're not sure when you're going to have your meals, you can take without food. There's a whole different types of range of tablets. The important thing is when you're accepting treatment, understand the importance that when you start treatment, it's really unwise to stop. Okay? If you need to stop because of some other medical thing or some other reason in your life, don't just stop. Please don't just do that. Speak to your sexual health doctor. They will transfer you onto a different type of tablet which will allow you to stop it in a more safer way. The reason why, if you just stop your medication and just think, I've had enough this week, I'm just going to stop, what will happen is the different drugs, because the tablets you take usually contain 3 drugs, the tablets you take come out of your body at different times, and so once there's only one drug left in your body, the virus can then come up and become immune to it. And just like antibiotic resistance in bacteria, you can have antiviral resistance for viruses. And so this is bad news, because that means that drug won't work. If you go back on your old medication again, it could mean that the virus will become immune to your other drugs. Okay, and while there may be 20 or 30 drugs, they're all grouped up into little groups. And there's around about 5 different types of groupings, and if it becomes resistant to one of those drugs in that group, usually it's the whole group it's resistant to, and so all of a sudden you're down to 4 types. So medication is not something to play around with. So if you start, it's 1 tablet every day for the rest of your life, and it should be at the same time, give or take 30 minutes. But just think about it, every day at the same time. And if you have any problems with the treatment, speak to the doctor, speak to the HIV nurse, because they're the ones who are specialists in it. And you should also tell your family doctor. If you think to yourself, I don't trust my family doctor because I know the receptionist, I know everyone who works there, then change your family doctor. You have to trust your family doctor, because your family doctor, as you get older, because people will live to a ripe old age. My oldest patient's 84. So people live to a ripe old age with HIV, and you're going to go on certain drugs which are related to old age, and they will react. Most of them will react to your antiretroviral medication. That can be avoided if your family doctor knows your antiretroviral medication. So it's fine to tell your doctor, okay? In terms of telling other people, well, it depends what kind of culture you come from. And so if you are come from the gay community and you've got a few friends who are HIV positive already, then chances are they should all be accepting and happy to understand what's happened. However, you may be thinking, well, that's got nothing to do with me, that culture. I'm black, African, female from Central or West Africa, and people get disowned or ostracized if they have HIV. Then obviously the advice is different for you, and that is actually probably don't tell people, because you can only, once you tell an individual, you can't take it back. And then they may tell other people, they may put it on Facebook. And so it's important to think through these questions. If you're wondering, well, if I'm HIV positive, should I tell other people about my status? I would say, if you're dating, before you have sex, if you like the person and you're going to have sex with them, you should tell them beforehand that you're HIV positive, in my personal opinion. However, if you know you're HIV positive and you know you're undetectable and you're taking all your medications and you've been undetectable for a long period of time, and also you're using condoms as well, so you're using every possible method conceivable, then you don't, if it's a one-night stand, for example, or a pickup, you don't actually have to tell those individuals that you're HIV positive. However, if that individual gets HIV from another individual and then finds out you're HIV positive, they may well, it may get a little bit messy. They may go to the police and say, hi, that guy didn't tell me he's HIV positive, and now I'm HIV positive, and so I now want to press charges of assault. Very, very difficult to prove, but either way, it's all going to be very, very messy. That mess can be quite easily cleared up by telling an individual you're going to have sex with that you're HIV positive. Yes, it's not exactly the most romantic thing to say, but it does make things quite clear. Obviously, if you're in a long-term relationship and you discover that you're HIV positive, then you need to tell your partner, and so they can get tested. If they're negative, also well and good, then they can take precautions, for example, PrEP, like I talked about beforehand, or wait until you've got your virus completely under control. Also, if you've had children of a certain age, they also may need to be tested as well, especially if you haven't had any tests during pregnancy. That obviously depends on what country you've come from. Most people, this is from the United Kingdom, this video, and most people who have given birth in the United Kingdom have had HIV screening, so they know their status already. So, prevention. Well, condoms are a good way of preventing all sexual infections, but condoms are not 100% effective. Condoms are, with perfect use, 95% effective, but in reality is more like 85%. The other way of protecting yourself regarding HIV is PrEP, and I'll be doing another video on PrEP itself in the future. Also, if you're going through different relationships, is that you and your partner go down to the sexual health clinic and you're both both of you get tested at the same time, so you both know your status. Obviously that works in a closed relationship, but if you are having relationships where open and you're having lots of sexual partners, then obviously it's condoms, and then you need to protect yourself with PrEP. The important thing to realise with PrEP is HIV tests, especially point of care tests, are only licensed for individuals who are not on HIV treatment, or so not on HIV medication, and have been exposed over a certain period of time, so they're outside the window period. So there's a period of when you get the infection to when it turns up into a test, and that can be on a 4th generation test, so the newest of tests if you like, 4 weeks. Some tests it's 3 months. So it's important to ask the doctor who's testing you how long that test is for. But if you're on post-exposure prophylaxis or PrEP, you may not necessarily get a true result. And that's something just to be aware of from a point of care test, in which case then you may need blood from the arm from an intravenous sample. For those of you who have taken a post-exposure prophylaxis course, the ideal time to get tested after that is 1 month after completing the course, and that way the result of that test is more guaranteed to be correct, and that's obviously if it's a 4th generation test. There's lots of checks and caveats and questions around this, and so my advice to you is, if you're worried about HIV and you want to get tested, please do, and you do that at your local sexual health clinic. Go and get tested, have a full sexual health screen, because with HIV a lot of people can also catch syphilis as well, and also gonorrhea and chlamydia. There's also other things you need to think about in terms of hepatitis B vaccination, hepatitis A vaccination, depending on your community, and so there's lots of things to think about. And also for gay men in the United Kingdom under the age of 45, you are entitled to something called the HPV vaccine, which is HPV causes warts, but it's also an anti-cancer vaccine to prevent penile and anal and head and neck cancers as well. So, a lot of information there. Go to your sexual health clinic, ask lots of questions, write them down if needed. You can also get more information from AIDS.info, from an organisation called ibase.info, also from the CDC, from the NHS Choices, from the British Association of Sexual Health, from the Terence Higgins Trust. There's lots, but make sure you get it from a bona fide source, okay? If there's anyone out there saying, oh, I can cure HIV, they're talking nonsense, absolute drivel. You cannot cure HIV, you can only control HIV by treating it with regular antiretrovirals. I hope you found this episode informative. I hope it's not too much information. And if you like it, press like, share it, and subscribe. I need subscribers. And see you in the next episode. Thank you for watching, and have great sexual health. Thank you.